Per my tradition, we'll give folks another minute and we'll get started at 7:01. Hey, good morning, everyone. It's just after 7, so let's get rolling. Thanks for joining us for our monthly town hall meeting. And just a friendly reminder, if you're not speaking, please put your phone or your computer on mute. Feel free to put questions in the chat box, which we'll be watching over the course of our discussion this morning. And at the end, we'll have an open Q&A either via the chat box, via the hand function. So getting started, the agenda this morning, Annie has been kind enough to offer to do the reflection this morning. I'll provide some COVID updates, some other recruitment and operational updates, and some recognition. Natasha is going to provide some technology and operations updates, and Trina will provide some updates on where we're at with our vaccine clinics. And then, of course, we open it to Q&A. We will be recording this meeting, which may show up across the top of your Teams bar there. And this is so others can access this afterwards if they weren't able to attend this morning. So with that, Annie, would you be so kind as to do our reflection this morning?
Yes. Good morning, everybody. So in the chat box, you'll see that I actually posted a very long reflection that I just thought was very fitting for what we're going through right now, but I went with the shorter one due to time for the meeting. So I just wanted to share that one with you. This is from the Catholic Health Association of the United States, and this is called When This Is Over. When this is over, may we never again take for granted a handshake with a stranger, conversations with neighbors, a crowded theater, a Friday night out, the taste of communion, a routine checkup, the school rush each morning, or coffee with a friend, the stadium roaring, or to take a deep breath, a boring Tuesday, or just life itself. When this ends, may we find that we have become more like the people we wanted to be, we were called to be, and we hoped to be. And may we stay that way, better for each other because of something that was the worst. And that was written by Laura Kelly Fanucci. So it's apropos moving into the week that PMG is moving into. We will be closing our tent, which we'll be discussing here shortly. And if you have time to read The Finest Hour, I think that just highlights the wonderful people that we have working for all of us at Providence and all of the caregivers who really did put their best foot forward to make our efforts of testing for COVID and our vaccine clinic run as smoothly as they have.
Wow, Annie, we could probably just hang up the phone now. Very, very nicely done. Thank you. Thank you for sharing that.
You're welcome.
A few updates from me. First, I'm gonna start with non-COVID related updates. First, in the recruitment arena. Excuse me. Ironic that I say not COVID and I'm coughing. So in the recruitment arena, we're presently recruiting for cardiology, for physiatry, for our outpatient neurology clinic, which will be brand new, of course. And we're also recruiting neurohospitalists. And we're in the early stages of considering adding ENT and urology to our existing services. We're also in the early stages of adding occupational medicine to PMG. And then, of course, we're always recruiting for primary care. And that includes faculty for the PMG Washington State University Internal Medicine Residency Program, which kicks off July 1st. And on that note, many of you may know that Jody Ferguson has accepted the role of manager for the IM residency program. So congratulations to Jody. Current commitments, we have an endocrinologist joining Dr. Badrea in the summer. We also have a cardiac surgeon joining Dr. Brevig's team. I believe she starts in May. We also have a couple of additions to the tax team over the next few months, and then a new palliative care physician joining us this summer as well. So the growth continues at PMG, and I just find that so exciting how we are very much growing as a medical group with a goal to become a full multi-specialty medical group. COVID related, some statistics for you. We are now, Snohomish County is now down to 119 cases per 100,000. Just after Thanksgiving, we were at 444. So that was the peak that Snohomish County hit. Our current rate parallels that of late March 2020, just to kind of put it in perspective. And it is a steep decline that's happening right now. And you know, we all know this is related to you know, physical distancing, masking, hand washing, growing rates of vaccination. So the light's definitely at the end of the tunnel. 11% of our patient visits are via telehealth, which I find very fascinating, exciting, and the fact that this technology is not going away. CMS has essentially embraced this being the new reality in healthcare, that so much of care can be provided via virtual care. And so kudos to those who have worked so hard to make this a success. But the really big success, and Annie alluded to it, is we will be closing our drive-through on Friday, or commonly referred to as the tent. It opened on March the 13th. It has seen over 9,500 patients, with the week in the middle of November being the busiest with just under 400 patients, 90 of those caregivers. But it's come to the point, the volumes are so low, it's tough to justify keeping it open. And I think Mitesh and I can't be more pleased to actually close a service line. And so with that, I really want to recognize some people who have made this a success. Annie, Jody, Betsy, and then people who have rolled up their sleeves and have, shall we say, weathered the cold at times. So Mo, Kiana, Kajal, Shauna, and Dee Dee. So all of you have put your heart and soul into this different way of delivering care to our patients. And so thank you for all of your hard work. That really, in many ways, we led the nation. We were one of the first to put up a drive-through testing clinic. We modeled after the work being done in South Korea, and all of you should be very proud. Finally, one other piece of recognition, actually not finally, two other things. One, just in the spirit of recognition, our newest ENT doc, Dr. Bama, is presently producing an educational series for the Seattle Science Foundation on facial plastic surgery. These videos are appearing on YouTube and Instagram, and apparently the first one, or one of the recent ones, has over 40,000 hits. And this is likely going to generate a lot of more interest in the type of work that he's doing around facial nerve facial nerve surgery for people who have facial nerve paralysis because of either Bell's palsy, trauma, or stroke. So really exciting what some of the work he's brought to PMG. And then let me just close with a call out on our patient experience scores. It's just been phenomenal the last year, but last 6 months in particular, to see our patients recognize the great work we're doing. Our most recent top box score is 87.7%. And this isn't about the numbers. What it's about is our patients appreciate all the hard work you're doing, the experience you're providing them, and this generates not only loyalty, and that's been shown in the literature over and over again, but it generates apostles, people who by word of mouth share their experiences, and that is more powerful than any billboard or any Facebook ad out there. So thank you for all you're doing. I have little doubt that some of the tools that have been put in place, like the clinician experience project tips, some of the deliberate work that's come out of the patient experience committee, and then of course just the passion that all of you have as you care for our patients every day. So with that, again, thank you, and I'm going to turn the baton over to Mitesh.
Hey, good morning, everybody. I thought that was terrific. It's great for us to be able to take some time and actually recognize both the hard work and the people behind it. It's something we'd like to do more of as we do these virtual town halls with all of you. So I'm going to take a step back and provide a little bit of a different focus this morning. I'll start with just simply the mission, vision, and values part of the organization. I think you're all very comfortable with the mission. The values are rock steady and you're familiar with them. The vision part of this sometimes gets lost, and the organization a couple of years ago went through and thought about where they wanted to be in healthcare, and you might remember that we came back to this messaging of simply simplifying health. And technology has a big part in doing that, and as part of that, Providence invested in, bought, or started to partner with organizations that focused on or had experience in technology very significantly the last couple of years. And it's amazing. There are a number of things that are rolling out this first half of the year that many of them which will make an impact on our patients, and a couple of them I think will be very relevant for all of us as caregivers. And thought I'd take a couple of minutes and just quickly do a round robin around those things. So things that are coming the first half of the year, e-visits. So we already have capabilities through MyChart for patients to connect with patients to connect with their clinicians. This formalizes more of an e-note, if you will. It has a billing structure if that's adaptable in the back end, but it's a very formalized way for the patient to be able to get a communication for a visit, either to their provider or to the care team. So we've been working on messaging on MyChart to be able to make that simply more formal. But when you think about face-to-face visits as already part of the way we take care of patients, the telemedicine launch, this is just one more way for us to be able to get the right communication and the right visit in front of the patient with the care team. So we have that coming down the pike this quarter. Most of you are aware that Impulse, which replaces Televox, is also on track for this first half of the year. We've already been starting to customize it if we needed to get out to patients and communicate that appointments were going to be canceled because of weather. So the tool's already available. We're customizing it as needed, and then we'll have a more formal rollout. But the text capabilities of that for patients with the offices is going to be pretty significant. And most of you already get lots of text from your dentist, for instance. It kind of puts us in the same spaces as what our dentist colleagues are already doing. So a couple of those I think are pretty significant for patients. The other one that's coming down is something called Binary Fountain. It's a social media tool, and as Steve and I have talked about this, the best way to think about it is sort of Yelp in healthcare. If you think about interacting with someone in realty or with a Nordstrom's or just about anybody right now, you have an interactive two-way communication through digital media between a consumer and the organization, and it can be kind of real-time feedback and reconnection. And we haven't had that in healthcare before. This sort of lets us do that to pull real-time communication or comments from patients and for us to be able to react, especially if there's a service recovery component to that. So that's something that we've started almost a year of work with and looking to roll out this first part of the year. So we have that coming to support our patient experience. And the last thing that I wanted to comment on was our no-show pilot. And several of you on the primary care side were part of a pilot where the patient engagement center helped us with identifying the 30% of patients that were most at risk for no-showing for whatever set of reasons. And we've just incorporated that straight into all of our primary care operations at this point. So it's one more way that we're trying to engage with patients to be able to call and remind them that they have an appointment coming up with us. So a number of things that are patient facing, and then a couple things on the caregiver side. One, we're moving to something called predictive hiring. PRMC moved to this last year, but it's essentially a kind of an algorithm, if you will. It lets us look at all of the data kind of in our own departments, in the market, takes all of this information and helps to take a 12-month stretch looking forward around where we may have vacancies. And it's one more way we're trying to get ahead of where we may have shortfalls in people in our clinical areas, and being able to hire and staff for those in advance. So that should create some additional stability just as we have vacancies happen in departments. And then the last one I wanted to call out, both on the caregiver and patient side, will be our replacement and move towards Genesis. That's the call center platform, new infrastructure that's just, it's just much more sophisticated than what we've had over the last few years, which many of you know isn't even really supported. So that's on track for a mid-March launch. So lots of technology headed our way over the next 5 to 6 months. So stay tuned.
Thanks, Mitesh. And again, this is really exciting as we, really modernize areas of our practice to meet the needs of our patients. So thank you. And feel free to put questions in the chat box as we go. Trina, do you want to provide an update on our vaccination clinics and all things nursing?
Happy to. Morning, everybody. Thank you for joining us this early hour. As many of you had probably heard either through the news or through other channels, our vaccines were delayed last week due to really poor weather on the East Coast, grounding planes and making the trucking delivery piece from the distribution centers very challenging. So we went from famine to feast. We've received 2 weeks worth of booster doses all at once this week. Yesterday we received 1 delivery, and then today we're anticipating 2 more. So we're off and running again with doing our booster doses this week. Overall, we vaccinated 3,920 people, which is really impressive considering all the challenges that we've had with vaccine availability. We do continue to have challenges getting primary care doses, the initial dose. So they are still being diverted to mass vaccination sites so that they can get to the largest amount of people with the least amount of volunteers. We do anticipate that we'll get some more. It's just going to be a little bit of time. We are collaborating with Snohomish Health District on those mass vaccination sites, so we will have some opportunity as people of Providence to volunteer at some of those sites that are opening up in the near future. So that's pretty exciting. And we have a new vaccine program coordinator, Angela Bryan. She comes to us from supporting Snohomish and Clearview in her role as a PSR, and she's going to take on a lot of the coordination and administrative duties that are related to the vaccine clinics, which is immense. And she's incredibly welcome and a sight for sore eyes for me, that's for sure. And then finally, I wanted to give a couple of updates for some rewards and recognition related to our caregivers. We have had the second round of our Bee and Butterfly Awards, and the most recent Butterfly Award winner for front office caregivers came from Women's Services and was Brittany Walker. And so we congratulate Brittany. And then our Bee Award that we just did yesterday was at Monroe, and that's for our exemplary medical assistant, and that went to Nellie Montez. So congratulations to Nellie. We'll be doing our Daisy Award for nurses here shortly. We're just working on a little bit of coordination of schedules, so watch for that, and we'll make an announcement when that person is notified of their prestigious award. And that's all of the updates that I have right now.
Thank you, Trina. Certainly we can open it up to questions. If you want to use the little raise hand feature, which is, I think, really cool. And then if you want questions in the chat box as well, excuse me, and there's one already. Do we have a provider/supplier for prescription goggles? I don't know the answer to that. And I don't know if anyone else on the call knows. Go ahead, Trina.
So that's a Sarah Wilkerson from Infection Prevention question, and I know that they were looking into specific vendors that could provide the appropriate glasses that had the ASTM rating on them, and I don't believe that they were ever successful in finding prescription glasses that met the needs. I will follow up with her to see if we've just missed communication somewhere along the way.
And Stephanie,
Trina, this is Sarah. Hi,
Hi,
I'm here.
Sarah.
Yeah, there are two options that were approved by both Caregiver Health and Infection Prevention, meeting all of the criteria. They're in our FAQ, and I can send you guys the link in just a moment.
if you could put it in the chat, Sarah, that would be great. Other questions? Really?
I did miss one piece that I'd like to share with everybody. Our volunteer roster is open through the end of March, and so there's plenty of spots available right now, and I will share the link in the chat for anybody who wants to go in and sign up.
That's great. Other questions, comments, concerns? Melanie has her hand up.
Hi, this is actually for Mitesh. I was wondering for the ones that were sent home due to COVID because of the spacing in the clinics. When are we looking about going back to the clinic, or is that even something that is being looked at, or because of productivity and so do we stay home? What's the future for the people who are sent home and working?
You know, the communication for Providence wide had been at least through July, we would maintain kind of the current stay-at-home remote model of care. But it's really going to be dependent on as we move through these multiple phases. But right now, there's no plan to change any of that. We're still encouraging people to be socially distant. And if you've got a working model that works remotely, to stick with that. If there's barriers to that, then we want to revisit that for sure.
Thank you, sir.
Other questions? How about feedback on these town halls? We've been doing them monthly. Is this the right cadence? Should we do more of them, less of them? Should there be other topics or issues we should be covering? Sounds like status quo is okay. I like them too. Once a month is great. I think these are great. Okay.
Yeah, maybe just an adjunct to that. We've had lots of conversations about frequency. We also know there isn't a perfect time. We've tried for this 7 or 7:30 and then another 12 or 12:30 to be able to get people at different times. And I know one of the feedback comments have been, could we simply record these and send them out? So certainly you saw that this is being recorded. If there's other recommendations for times too, very open to that as well. We all look at this as a priority to be able to connect with our teams.
Well said, Mitesh. There is a question, Trina. Do we know if there will be another opportunity to sign our family members who meet criteria for vaccine?
So I am wondering if Eric is on. Doesn't look to be on. So that's a PRMCE clinic. What I can do is touch base with Eric and David Williams to find out what the game plan is and get back to everybody. So I'm unsure at this time.
Thanks.
Any other questions, comments? Well, hearing none, thank you everyone for all your time, and look forward to connecting on this forum again in about a month. So have a great day, everyone. Thank you.
Thank you. Have a good week.
Thank you.
Thank you. Have a good day.